For the first time in a decade, overdose deaths among teens in the United States rose dramatically in 2020 and kept rising through 2021 as well. That's according to the results of a new study published Tuesday in JAMA. This is very alarming because what we've seen in other parts of the population is that when overdose death rates start to rise, they tend to continue to do so for quite some time, says Joe Friedman, a public health researcher. And that makes this an especially important time to intervene, he adds. Friedman and his colleagues found that fatal overdoses among adolescents nearly doubled from 492 in 2019 to 954 in 2020, an increase of 94%. There was an additional 20% rise in 2021 compared to the previous year. The highest rates were among Native American and Alaskan Native teens, followed by Latino teens. For decades, we've seen overdose rates rising among adults, and teens have been insulated from that, says Friedman. And now, for the first time, the overdose crisis is reaching teens as well. It appears that the rise in deaths was fueled not by greater numbers of teens using drugs. Substance use in this age group actually went down during the pandemic, but by use of dangerous and highly potent forms of fentanyl. The study found that fentanyl-related deaths increased from 253 in 2019 to 680 the following year. And in 2021, 77% of all teen overdose deaths involved fentanyl. However, unlike in adult overdose deaths, it's not fentanyl and heroin that's responsible for the deaths among teens, says Dr. Nora Volkow, director of the National Institute on Drug Abuse, who wasn't involved in the new study. Teenagers don't seek out illicit opioids, but they do seek out prescriptio. And they also seek out benzodiazepines. And they often end up buying counterfeit versions of these medications, fakes that look like the commonly used prescription medications, which have increasingly become contaminated with fentanyl in the past couple of years. It is estimated that at least now you can take one benzodiazepine, one pill, and it can kill you. This means that occasional or recreational users can be at risk of dying, says Sheila Vakharia, Deputy Director of the Department of Research and Academic Engagement at the Drug Policy Alliance. That's why there's an urgent need to better educate teens about the risks of counterfeit pills and give them tools to help them use safely, she says.